Hello everyone, my name is Roshandan, and today I'll be presenting what I did over the summer. So I did a few different projects. The first one at NYU Langone Health with Dr. Hank Wang, and I also continued a project at WMC Health with Dr. Keiji Okumura and my dad, Dr. Dao. So for what I did over this summer is I investigated prosthetic infections with up to 2% of people who get a prosthetic developing infection a few years down the line. So I looked at how effective PCR or genome-based applications can be in diagnosing these joint infections. And what this can do is can help improve diagnosis and prescribe the right antibiotics to treat these infections. So what I did is analyze the PCR results from 300 plus different joint fluid samples from patients. And what I'm going to do is use all these results from NYU Langone and other Long Island hospitals and compare them to culture results, which are the actual lab-grown bacteria. And by doing this, I can compare the effectiveness of the PCR to culture-based diagnosis. However, for this year, I'm going to be mainly focusing on a continuation project based on my research on organ transplantation. So for the last 12 years, the amount of organ transplantations have increased every single year. However, 100,000 plus people still wait on the wait list to get a transplant. At the same time, there was the COVID-19 pandemic, which posed a unique situation for the society, especially with regard to organ transplantation. And this allowed for a new venue of research where we can look at the intersection between COVID-19 and organ transplantation and improve health outcomes and policy related to it. So last year, I found out that during the COVID-19 pandemic, and from 2014 to 2021, there was increased drug overdose and firearm injury deaths. And this aligned with a variety of other risk factors. So what I want to do this year is look at how these deaths correlate to the community resilience estimate, which is an index that I will continue to explain later on. And what this will be able to help us with is exposing societal trends and help guide government and hospital policy. So my methods for this research is mainly using the CDC-1 or UNOS databases, which provide nationwide data sets that help us understand the death rates as well as organ donation rates. And this provides a nationwide overview, as I said, and I will combine these data into Excel sheets in R to produce results. So these are my results from last year. In graph A, I show the causes of death, firearm injury, and substance abuse in the general population. In graph B, I show organ transplantation. And we found that from 2014 to 2021, both of them rose. What I expect to find in my new findings, which I'm going to be looking at 2022, is that these trends will continue to go upwards. So we're going to see greater rates of death from firearm injury and substance abuse and greater rates of donation from these two causes of death. Now what I also did last year is looked at different regional variations. And I saw that substance abuse death, firearm injury death, as well as poverty and health insurance, as well as income inequality, were all linked in certain regions of the United States. And it also linked to the community resilience estimate. So what I want to do here is the community resilience estimate shows which communities are most vulnerable during times of crisis and public health emergencies. So what I did last year is I looked at by state. My goal for this year is to look at it by county, and this will provide more precise results and identify which communities are most at risk during these public health emergencies. So I want to continue with looking at it by county and more specifically into these different health factors and other outcomes. And the conference coming up in October. So overall, I want to finish my data analysis by October 1st, decide on a main project for Westwood by October 1st because I do have the two different projects, and then finish my STS essays, and I'll likely be using my continuation project from last year. And that's a little picture from me at the New York State Science Congress last year as well. Thank you.